Good afternoon, everyone. We're going to go ahead and get started. My name is Kimberly Fowler, and I'm the Director of Technical Assistance and Research here at the National Council of Urban Indian Health. We really thank you for joining us today for this webinar on achieving excellence through accreditation. At this point, I ask that you, if you haven't already done so, to please provide your name and organization in the chat box located in the lower left-hand corner of your screen, just so that we can acknowledge that you're here. And as I mentioned, we're the National Council of Urban Indian Health. We're a membership-based nonprofit that represents the 43 urban Indian health organizations across the nation that provide essential health and social services to American Indians and Alaska Natives living in urban settings. So right now your lines are currently muted. However, if you wish to ask a question, we ask that you place them in the Q&A pod in the lower right-hand side of your screen. This will give us an opportunity to gather those questions for our presenter so that she can answer those at the end of the presentation. But at any point in time, feel free to write in those questions just so that we can have those available during the Q&A at the end of her presentation. So today's webinar will feature a presentation by Ms. Mona Sweeney. She is the Assistant Director for Accreditation Services with the Accreditation Association for Ambulatory Healthcare, also known as AAAHC, and she's been there since 2012. She's actively involved in the development, education, implementation, and promotion of the primary care and medical care home programs, standards, and survey process. Serving as staff liaison to the Standards and Survey Process Committee, she participates in the development of the standards themselves. As project manager for HRSA's Accreditation Initiative contract, she works with FQHCs to achieve medical home accreditation. She has created and delivered the content and programs for numerous webinars and on-site workshops, so we're excited to have with us today Mona in order for her to present and share with us today on resources and tools for preparing for the accreditation survey process. So before we move into the presentation, I would like to remind everyone that all participants are currently in listen-only mode, and we ask that you place any questions in the Q&A pod at the lower right hand of your screen so that they can be answered during the Q&A portion of the webinar. So with that, I will turn it over to Mona Sweeney. Mona, you have the floor.
Kimberly, thank you. And I can't tell you how much, as a representative for AAAHC, that we appreciate the opportunity to speak to you all. Some of you I know, I'm recognizing some of the names, and others I welcome an introduction. Beyond the objectives that I'll touch upon in the next upcoming slide, I just want to share with you that really my personal goal for today's program is to inform you about our programs, but beyond that, provide an insight to what our philosophy is in working with our organizations. That really seems to drive how it is that we partner in the process with our organizations. We want what you want. We want, beyond a successful survey, we want to help you improve the quality and safety of the care that you provide. In essence, as mentioned, partnering in the process rather than coming to inspect any kind of product that you have. So what I've done is created these learning objectives highlighting in the green some of the additional activities that are provided for those of you who are 330 grantees. And I thought because you'll get these slide decks to take with you, my apologies for those who are not 330 grantees, but I wanted to have sort of a summary of all the different programs and again, activities that are associated with working with AAAHC. So again, anything you see in the green, for the most part, going forward, will refer to the additional perks, if you will, or activities that are provided by HRSA in participation with the Accreditation Initiative and the PCMH Recognition Initiative. So what are we going to do? Certainly we're going to learn about AAAHC, and I hope that you can see why accreditation is a good fit for Indian health centers and certainly with AAAHC. For grantees, we'll review the HRSA Accreditation PCMH Recognition Initiative, knowing that there's a PAL involved for you to respond to. For all, we're going to gain knowledge about the standards in our process, and really to get the appreciation that this is really a roadmap in preparing you for a survey with include medical homes. We're going to hopefully you'll see, and I think you'll see a better sense of this when you get our standards and when you read them. You'll see the overlaps with other program requirements. Again, thinking about our philosophy, we're not looking to provide you with additional requirements and work. We like to see where things line up. We know that you've got reporting requirements, and we'd like you to take advantage of those to meet some of the standards that we need, particularly when we're talking about developing quality studies, and we'll talk about that in the future. We also want to understand what to expect your accreditation survey and identify some of the resources that we have available. So I think at this time, Ryan was going to send off a questionnaire just to give me a sense of who's participating in this webinar. So if you wouldn't mind just quickly responding to this, and we'll just have an idea of what our audience is composed of.
So I think the poll has been closed out, and it looks like we have approximately 63% of attendees are not 330 grantees.
Okay.
Just for information.
Okay, great. Okay, so it looks we're getting there, right? Thank you for that. So not to take up too much time, I think we'll just go back to our presentation and carry on. So a lot of you, this will be a first foray into the world of accreditation. I think we're really great partners with someone who has not gone through the process, because we appreciate, and you'll see as I talk about some of the other organizations we work with, why it's a good fit. So I'm going to move on. Acronyms, everyone uses them and certainly takes and plays with them. I like to say beyond being accountable, accessible, affordable healthcare accreditors, honestly, we're all about assisting healthcare centers. At present, we're about 6,000 plus in the number of organizations that we've been working with over the past 38 years. We have 455 sites that have achieved medical home at this point in time. We are private, not-for-profit, independent, and we truly stress the fact that we're a peer-based accreditation program with experienced surveyors from all walks of life that relate to what you do. And why do we choose it? Choose AAAHC? I think we do stress the fact that we're rather consultative and educational in our approach. Really, the interaction through the survey, and even at the point of beginning the application, we're all about responding to your questions, providing solutions, other ideas and answers to some of your questions, some of your concerns. We'll learn a little bit more about the fact that we really appreciate the fact that your organization is unique, and we need to craft our standards in a way that you can make them interpretable to your organization, and I'll highlight why that's important to us. We also feel that the on-site process provides you the opportunity to have everyone, all stakeholders that are involved in delivering care there, that are full participants in our summation conference, and I'll explain more about that in a bit too. You will also at the end and after the evaluation receive this survey report, which really does act as a blueprint for your continued transformation and improvement as you carry on within your center. Always focusing on quality, because we feel that that's what leads to improved outcomes. It also gives you an opportunity to sort of identify the risk management issues that you have and you know, but you don't have an opportunity to attend to. This really gives you a focused time to work on those. Really stress about the fact that the survey is not unannounced, that is decided upon the date based upon the mutual agreeable dates provided by the organization and our surveyor's availability. We don't want the medical director to be on holiday when we come out to visit. We want everyone to be there because that really is the culmination of all the hard work that you've had, and it really is part of your transformation. So how do we compare? I think most easily to Joint Commission because we both provide on-site. So I don't highlight necessarily NCQA, which is an attestation process. It is an opportunity in my mind that is more one way in interaction and in, the result is that you become recognized. But where is the to and fro beyond that that gets you the opportunity to learn from our standards and from what you are doing? So our survey is all in one. It's an accreditation in medical homes. It's all in one versus Joint Commission requires you to be accredited before you can become medical home certified, and they consider it an add-on, so they can put it together with the survey, but it's a different process. I have already mentioned the fact that we decide the dates mutually upon a mutual agreeable discussion. And we really, because we were born from the hospital circumstances when physicians left and started setting up independent practices, we created standards specifically for dedicated to ambulatory care. We are less prescriptive as a result. I mentioned that our surveyors are your peers. They are not our employees. We don't call them inspectors. They gather your best evidence to make recommendations for accreditation. They really want what you want. I've actually seen on survey where a surveyor will sit down and review a quality study with the director and have them explain some of the things that they don't see in the written document and say, I'm here till tomorrow. If you can go back and capture what you just discussed with me into this study, that's what I'll take back for you. So there's actually, ongoing consultation at the point of survey. Again, we're more a process of discovery, consultative, and collaborative. We have over 350 surveyors nationwide. I mentioned they're actively involved professionals. They are not our full-time employees. They have day jobs that may very well reflect what you're doing and maybe consultants in your industry or actually work in such facilities. With extensive ambulatory care experience, we have a rigorous mentoring process and privileging and reprivileging. They have training every 2 years. Talked a little bit before about our focus and philosophy, again, enhancing quality. And I mentioned that our standards are designed to promote excellence and professionalism and safety. And again, we're very consultative. The standards are formed based upon a consensus of what our best practices. We update them annually. We provide an opportunity for the public to comment, to tell us what either organizations that are working already with us, what's worked and what doesn't fit, and also make other recommendations. It really does identify what an incredible organization is going to be, and we keep saying and stressing that we don't want to be prescriptive. We certainly require and are prescriptive where we need to be, so we expect a comprehensive program, but if you are using your own or a different metric for your quality studies, as long as you can answer to the standards, we don't expect you to rewrite your reports, your study in our format, and there is a specific format that is helpful if you've not done this before. Our handbook is divided into 8 core chapters and 17 adjunct chapters, which includes medical home, and I'll talk to you about that in a little bit. And the true ratings systems right now is partially and non-compliant or not applicable. That I might highlight that is going to be changing. I won't have the opportunity to speak to this, but as I mentioned, we do have a rigorous review every year, and we actually are changing the rating system that will be rolled out in September. Right now, the standards are written in outline format. So who do we accredit? I mentioned that we're not prescriptive, in fact, because if you look at all the different types of organizations we accredit, you can immediately think of how disparate that they are. The military is going to be very different than Indian Health or a women's health center or a college health. So We know that the core chapters have to apply to everybody, and the adjunct chapters are based upon the services you provide, but the way they are written has to be effective and applicable in both of those, in all of these settings. As I mentioned, the core chapters are listed here. They apply to all organizations because regardless of what kind of care or clientele you deliver care to, these are the things that are really important to everybody in order to deliver safe and quality care. There's an asterisk here mentioning that there are worksheets at the back of the handbook, so there are a lot of support materials that provide you the opportunity to understand that this is an open book test. Mentioning again, the worksheets are the same worksheets that our surveyors will use. So you can actually conduct your own mock surveys to get a sense of, and a place and time of how you score, and know that that's what the surveyors will be looking for as well. Adjunct Standards. So I mentioned that's the other 17 chapters. As you can see, they're based upon what type of services you provide. Certainly highlighting dental and behavioral and medical home as really, the cornerstones for integrated care in primary care. And we can talk individually about which chapters apply or don't apply when we begin working together. But we're looking in accreditation at the functioning of your entire organization in all the different areas of care that you provide. I will not dwell on, but those of you that are 330 grantees are familiar with the PAL that provides you guidance as to how to comply and be a part of the recognition initiative. And the perks with that is, besides the fact that they pay for everything, the fees are covered. There are additional activities that are paid for. We do a virtual survey, which is a 2-hour pre-survey assessment call, a mock survey, which is 1 day, 1 surveyor that does not count against your survey. Again, and this applies to everybody, you get organizational accreditation and medical home accreditation per site, 2 separate certificates. And of course, this is for everybody, education, mentoring, and resources. And I will say, for those of you who are not HRSA 330 grantees, we actually do some of this on an individual basis with organizations as they're preparing. It may not be a 2-hour pre-assessment call, but I welcome your emails and phone calls when you're looking for any interpretation of the standards and if you'd like to discuss where you're at. Again, nationally recognized accreditation medical home, that's across the board for everybody. Certainly pride within the organization and the community. I always say you can certainly tell your clients that you're delivering the same quality care and rigorous review as some huge medical group practice outside of your own practices. They receive that same, you have that same rigorous evaluation. So it's certainly something that can boost your marketing to your to your clientele, provider recruitment, patient recruitment, and financial rewards. As healthcare is changing, we're looking and hoping for you to get rewarded for the type of care you receive, and HRSA does provide that, as do payers. So for the HRSA Accreditation Initiative, there's an NOI that's filled out for those of you in your EHB, that's your portal through HRSA, and I'll just leave that information there for you to access it at a further time. HRSA will review it, they'll let us know, and then we can begin the process and we'll send you material. For everybody, once you decided to participate, we will send you a PDF of the handbook and also other materials that are helpful to your organization's preparation. Some of those include, you have the opportunity to be educated by some of our marketing materials that get sent out, so there's an email opportunity to sign up and get some of the additional information. And how do we begin? Again, stressing that we really do support you one-on-one with organizations, phone calls, emails, scheduled conference calls, whatever is required. And I think the beginning steps to any project that you undertake is creating a timeline for events for yourself to see, working backwards, when do you think you want to be accredited, when would you want your survey, and working backwards, being able to complete all the different activities that will lead to that successful survey. In green, again, everyone should conduct a self-assessment, looking at the standards, rating yourself, getting an idea of where your gaps are and seeing where you are in one point in time. For the HRSA orgs, you'll submit that self-assessment to me. We'll schedule the call as mentioned, and all the other activities apply to everybody. We have a team approach to our working with our clients, and so we'll actually have account executives who will be assigned and work with you individually with me to work towards your accreditation. Like anything, it's identifying who's going to be the staff members that are involved in the pre-assessments. If you think about all those different chapters, there are different areas of expertise. Your pharmacy will be different from the lab, different from the behavioral health, so they can be responsible for those chapters and those standards. So you need to go through that process of identifying who they are, and select chapter checklists, and using these tip sheets just to continue getting you moving on. Reviewing yourself against the standards is something that you'll get to see as to where you need to tweak or what is missing. The things that you'll be doing is reviewing your policies and procedures and document any updates. You might have things understood, but they may not be written, or they may not have been approved by your board, and this gives you the opportunity to gather all that. It really takes people from working in their silos to getting them all to work together and understand what's going on. Again, I said the worksheets are in the back of the book, so you can use those. There are clinical worksheets, personnel, and credentials. Looking to make sure you're maintaining your logbooks, maintenance of your equipment in the labs and the like, and cleaning schedules, also your own mock survey, if you will. In summary, our core chapters are 1 through 8, and the adjunct chapters are 9 through 24, and chapter 25 is medical home. And that chapter, thinking about it, it's the way you deliver all of that care, whether it's behavior or the lab or the pharmacy. How are the tenets of medical home incorporated into how you deliver care? In my estimation, particularly with Indian Health and federally qualified health centers, you have been delivering care as a medical home that is part of your own philosophy, and we're now naming it. But more importantly, we're hoping to get rewarded for it, and that's why we've got the constructs, we've got the concepts, and we've got specific activities that help measure relationship, comprehensiveness, accessibility, and all those things that are important in a medical home. Speaking of medical home, whether you're recognized as a medical home or seeking for the first time, including it guarantees that you have medical home trained surveyors who will be looking at your facility but also can speak to those tenants and give you some suggestions. Again, consultation is a big part of it, and you'll certainly receive 2 separate awards. Your organization is accredited, and you'll receive a certificate that reflects that you're a medical home. This is just a snapshot of what the handbook looks like presently, and it really is in a summary format. We've got letter and sub-elements, and you do a self-assessment based upon where you think you are at this point in time. Substantially, partially non-compliant, or the standard may not be applicable. When you're doing a self-assessment, I would include brief comments as to why you think you are that at that brief point in time, and it'll give you an opportunity to identify what tasks need to be done to raise that standard level to compliance. Just to give you a definition, I think I just want to highlight that at this point in time, substantially compliant does not mean 100%. So that, again, reflects our philosophy and understanding that we're looking to have you raise the level of your quality and safety, and not necessarily to be 100%. If you are, that's great. So, again, we talk about the fact that when you're looking to see where you are, you've got your ratings, you see where you are deficient, why you think you're deficient, and what your plan for improvement is. We've actually put the standards in an Excel spreadsheet just for that purpose, to allow you to kind of do that self-assessment and keep track of where you're at. One suggestion is to create chapter champions. As I mentioned, there are different areas that people have expertise in. Your risk manager might be somebody different than your quality care person. So again, that gives you an opportunity to work on it and set target dates and move forward. For grantees, the pre-survey assessment call, as I mentioned, it really would be the opportunity to have a 2-hour phone discussion that reviews your self-assessment compliance with the standards, some suggestions, some other references, bring up concerns. We like to have the whole team on the call, so if someone in the lab or someone in pharmacy or behavioral health has a specific question, that's another opportunity to get more insight. I mentioned that we have an account representative team. Eliana is your survey process account representative. This is where the application is available, and really it says 3 months prior to the survey. That could be even a longer period of time as well, but we can talk about that when we're talking specifically to each of your organizations. In the application, we will have you submit and upload documents that allow us to review them prior to the survey. We'd like to have as much information about your organization prior to, so that the time spent isn't sitting and reading and getting to know you, that we'll have a sense of who you are before we can get there, so we can actually provide, the surveyors can provide a consultation that is of value. I mentioned that we'll be in conversation with you, getting dates that you think you'd like to be surveyed, and as I mentioned, we'll make that agreeable. Times a team is assigned. We will make sure that if you've been accredited, that we get in there before you expire, and also provide communication with you. The survey chair talks to you before the survey. Typically, it's 2 to 3 surveyors, 1 to 2.5 days. It all depends upon how large your organization is, how many satellites you have. The on-site survey begins with an orientation conference with your board can be there, or whoever you want. They give us a brief orientation, and we also provide a summary of what will happen in the 2 days. They'll take a tour of your facility, and certainly then begin some of the evaluation of your facility and clinical records and personnel. So they'll start at your headquarters, if you will, your main site where you keep those records, and then divide and conquer with all the other satellites and get together at some time to talk. We actually review organizations by observation, conversation, so that's interview, and document inspection. That might involve your clinical and administrative staff. It might involve your receptionist, and it certainly will involve your patients with their permission. We will review your policies, procedures, and any other documentation that supports your compliance with any of our standards. And in the event that you do any surgical procedures, particularly in dental, we do require to observe a surgical procedure, and I'd like to highlight that we would include a dentist as one of the surveyors on your survey if you provide dental services. Summation conference is held at the end of the survey. It lasts for about an hour or so, and it should include all of those that have participated in your preparation and or board members, whoever you would like, any leadership people, key people that would like to hear it. We like to hear it from the surveyors instead of being a funnel through the executive director or whomever to everyone else. We feel that it really provides the weight that's required. They'll highlight the things that you've done well and might identify some of the areas that they found for improvement, because really we would like nothing to be a surprise to include the survey report. They don't make the decision. They make recommendations, and that becomes an internal process through our accreditation committee, who finally and ultimately makes the decision based upon all the materials that were submitted. And we find that that arm's length transaction, what I call it, provides more of a collaborative appeal to the surveyor with the organization versus the one who's holding the weight of the decision. They're there to gather your best evidence. Some of the other materials that are reviewed on survey: committee minutes, personnel policies, clinical care records, QI, contracts, any contracts you have with any subs, and certainly any balance sheet. Again, they're not going to make judgments on it. They just want to make sure you have all of the things in process and in progress to continue functioning as a credible organization. Patient education materials, certainly internal disaster policies, drills, staff training, satisfaction, patient satisfaction surveys, very key, rights, patients' rights. And with all of this, particularly with the patient's rights statements and satisfaction, when you're talking about medical home, that's the one that becomes integral to your organization's delivery cares of medical home, because those are very important. Are the medical home tenants invoked in your patient rights statement? Do you ask them questions that reflect your own self-evaluation of delivering care in medical home? As I mentioned, surveyors are the eyes and ears for AAAHC. They will observe your direct practice. They know what the standards look in action, so you can ask questions and they can address issues Remember, it's an open book test. As I mentioned, they gather the information that represents you best. So what can happen after the survey? The decision can be a 3-year accreditation term with medical homes. There might be an opportunity that you need to submit a plan for improvement. So you get the decision, you are accredited, and the accreditation start date is the last day of your survey. But we might ask you to present your plan for improvement based upon the standards that were rated non-compliant or partially compliant. We're looking for your continued plan and work. This is not an end game to have you do the survey. It's again, as I mentioned, that next step to take and then work with those reports and see what's partially or non-compliant and what is your work plan to improve those going forward. You might be awarded a 3-year term for accreditation, but if in fact we found something, let's say an infection control as an example, problem and issue, we might say, all right, we know you're going to fix this, but we have to come back in a year. We need to see that this has actually been executed and improved versus just an attestation. So that might be the opportunity for improvement with a survey. And then the last one, of course, is if in fact you were denied accreditation. Our certificates are, again, something that you can share with each of your satellites. And so you get a term for accreditation. That's the oversight of your entire organization. And then if you've chosen medical home, you'll receive an additional award for medical home accreditation. And if, in fact, we're the only ones that have a dental home program, we're looking to see how integrated the dental practices are within your organization, and if they are functioning as a medical home partner, you can choose it, and that's optional. You do not need to do to comply with those standards and submit an assessment for that. So that's an optional addition. AAAHC has other resources online to include for the HRSA organization, webinars that reflect a review of the standards chapter by chapter, and I should say chapter and topic specific. And that there's the link for access to that. It's on the AAAHC website. And I also am wondering if you have any questions or comments.
Thank you, Mona, for that really enlightening presentation on accreditation and on the work that AAAHC does in order to maintain, as you said, that collaborative nature with programs seeking to be accredited. I think there's a lot of information that our attendees have gained from. So at this time, if you have any questions, please feel free to write them into the chat box so that we can get those answered. Also, I'd like to make note that the presentation slides are available right now in the box titled Files 2. So if you'd like to download the presentation from today in order to review some of that information or share it with some of your colleagues, please feel free to do so. You'll also receive that presentation as a link following the webinar through a follow-up email that might be coming out. So it looks like we have a question.
Shall I read the question?
Yeah, if you can see it, feel free to.
Sure. I don't know if I can see the whole thing. Let me see here. So the question is, once an organization is approved by HRSA, what is the time frame in which we'll be contacted by AAAHC to start the process? Also, what does the blue highlight mean in some of the areas of the handbook? Okay. Yeah, once you've submitted your NOI to HRSA, we need to wait to hear back from them. That takes a couple of weeks, sometimes sooner. We are working on the next task order, which means the new contract that technically starts in September, but the work can begin even prior to that. When I get approval from HRSA, I will contact you. I'm often in email contact with the organization even prior to that because I can send the PDF of the standards so we can start working ahead of time because we do know that there are timelines. So it is a couple of weeks, but we'll definitely, September is a great time to start, and just getting the handbook and getting familiar with all that prior would be great. The blue highlight, there were circles at the top of the handbook, the standards, each chapter has a circle with a number, and what we have in that circle highlighted are where do other chapters overlap with those standards in that particular chapter. So it gives you an opportunity to see where some of the similarities might lie throughout the handbook. What does the blue highlight mean? Okay, that was that. And the next question is, do you have an example for a medical home statement in the patient rights? You know, we want to know what it is important, how it is important to your organization. I think the main thing is if you look in the chapter that talks about patient rights and responsibilities, some of the standards will lead you to what those statements should be. So as an example, you know, we look to see that they're partners in the process as well. So have you identified what their roles need to be as partners in providing care to them? It's looking just for some of the language of medical home versus someone who may have cut and paste patient rights responsibility from another clinic or a hospital. So it really is making it your own. What is the cost for the organization? I'm more than happy to give you an estimate, and I'm not being evasive, but it really depends upon the number of satellites, the number of providers you have, the number of patients to a lesser extent. Some of it reflects the logistics that might need to be thought about, and that is how many surveyors, how many days, and how far apart are your other centers. So if in fact it's not doable to divide and conquer in one day, and then you might need to do them in 2 days because the satellites are so far from each other, that influences the cost estimate. I will say that coming on site puts us more aligned with what Joint Commission is, but as I understand it, our fees are less expensive. Maybe it's because we have an all-in-one survey. We don't charge additionally necessarily for medical home, although it does require more time. So it's an all-in-one cost. We don't have any additional membership fees or renewal. The only thing is if you were required to do an interim survey, that is, you receive the award for a 3-year term of accreditation, but we need to come back, there would be that cost for one surveyor to come for 1 day a year from now. Okay, sorry. Okay, what other questions? Any other questions from anyone? My contact information is included in the presentation handout. I look forward to getting to know any of you who would like a little bit more information. I find that sometimes when you get all this information, it's certainly, you know, you can process it, but once you start thinking about it within your own organization, other questions will come up, and I'm, you know, more than happy to address those at that time. I think that happens sometimes when our standards are written such that they're interpretable. I will tell you that our, you know, the new format is really going to make it very clear as to what we're looking for and how that standard will be rated. So we're always looking to improve as well. Here we go. Can a business consultant participate in the 1-day pre-survey assessment? Okay, so there isn't a 1-day pre-assessment. If you're talking about the HRSA accreditation initiative, there is a 1-day and maybe 2-day, we'll see what happens with the next contract, mock survey where we come on site. Our rule about consultants' participation is that it's not necessarily prohibited, but it is something, one, that has to be approved by the organization themselves, and also, you know, with no, obviously, you know, suggesting that, you know, you can have interaction, but there's no influence, if you will, interference, or whatever, however you want to call it, to say on the actual, I'm speaking about the actual survey for all the other organizations. So, you know, it's a very professional and respectful experience, and that's what we, you know, require as well. Any other questions?
That's the last question I see, but definitely if there are others, please feel free to go ahead and type those in. While we're waiting for other questions, I would like to mention that you will be receiving a survey and evaluating this webinar. We ask that you just take a few moments just to take that brief survey. It's only about 2 minutes. And also, it's located in the chat poll here if you would like to just click on that currently right now. Once again, the presentation slides as well as the recording will be available on the CUI's website within the next couple of days. So definitely keep an eye out for those, for the recording itself. It'll be on our homepage at ncuih.org, as well as in the follow-up email you'll receive the presentation slides.
Yeah, I think the thing that I would like to add is that we have educational opportunities that are available to everyone 4 times a year. And the next session is in September in Washington, D.C., and then in December in Las Vegas. And it's a 2-day, we call it Achieving Accreditation seminar. And a great, what I really like to highlight is the first, so what we do is review all the standards, and the presentations are conducted by our surveyors who act as faculty. So you might actually meet someone who come out to be your surveyor. We have everybody all together the first day, so we go through the core chapters because it applies to everyone. The first afternoon, we conduct a workshop, which really is, you know, one of the great perks, if you will, of attending Achieving Accreditation, because we do a quality workshop. We put all Indian Health together. We go through what our process is, how do you do and develop a quality study. We've developed a toolkit, if you will, that you can then take back with you and kind of teach the teacher. It gives you the algorithm and worksheets and things that you can take and create an idea of what you want to study, and step by step, when you answer those questions and fill in the blanks, you literally created your template for what your quality study should look like. A lot of opportunity to review actual studies that gives you the experience of what a surveyor looks for in reviewing a study. And I will tell you hands down that more than often, participants are much more critical of those studies than what the surveyors would actually say. And it really is always bringing back, when we review our standards or whatever we're doing, what is the intent? Why did we write the standard? What do you think? Why is this important, and how is it important to your own organization? And the last thing I'd like to say in terms of something that is important to your organization, we are acutely sensitive to cultural differences, and when it comes to some of the standards, if in fact there is a different way that you'd approach that standard, that is something that we are respectful of, and it's something that is taken into consideration. So with
Thank you, Mona.
Yes, the information about the information about accreditation training is on our website. Is there another question?
Is there a Dallas AAAHC chapter?
I'm sorry, is there what?
A Dallas, Texas AAAHC chapter?
Dallas. Well, we are a national organization. Our headquarters are in Skokie, Illinois. Our surveyors live all across the country. So we don't have chapters. This is us here. Our organization is here in Skokie, Illinois.
And one additional question is asking if there will be a change to the handbook from what's listed in the 2016 handbook, because they currently are using the 2016 handbook.
Right. So 2 things. The standards in and of themselves have not changed. The 2017 handbook has actually a couple other tools in it that you might find helpful. For example, we've actually listed in the tools, we've got a document that lists all of the required written documentation, policies, and procedures. So, I can certainly get that to you if you shoot me an email. And again, preparing for your accreditation using our handbook as is in 2017 or 2016 will get you ready for the survey. Once that is published, we'll get the others to you, and then you'll get a sense of what the differences are, and I think you'll really be appreciative of it.
And a follow-up question to that is, the SCPC-NC will be changing possibly in September. Will this change impact the questions?
Yeah, no. So again, it will not. We're going to. Doing that self-assessment gives you an idea of where your gaps are. Think of it from that perspective of what is missing. So if you're SC, that's good. It'll give you an opportunity to work on those things, and when you see the standards, basically it's taking it and saying, here's a standard, we'll look for this and we'll look for that. And you will have already done that self-evaluation. So, stay tuned and you will get to see how it looks different. Okay?
And one more question. It's asking, how long is the process of becoming accredited?
Well, it really depends upon where you're at within your organization. There are smaller organizations, as I mentioned earlier, who might have, they don't have the written policies. They're implied. People are trained on them, but they actually don't have them documented or evaluated. Or you don't have a written infection control program, or risk management isn't part, or credentialing, privileging, and peer review isn't all, aligned together and integrated, I should say, in your privileging. So your peer review has to be part of your privileging information. So it just depends, but generally speaking, if you've never gone through this process before, I would say 7, 8 months, 9 months. It just depends. I've seen it all over the ballpark, and for some it's been really over a year, because really also depends upon what your resources are. And I will also say that in my estimation, one of the key elements for the success of all this is that the leadership has buy-in, that they're behind this, that they really support it. Because I do know those of you who are doing all that work, if this feels like another responsibility or another job, or it's just one person's job, it makes it very difficult. I think it is a team project, and I like to try to encourage that and support that, and that's why I'm happy to have a kickoff call to include everybody, so you can hear it from us of what the value of working together on this versus having one person assigned to get this all done and submitted. And recommending, I will tell you, I'm always impressed how many people come to achieve accreditation even after they've been accredited. Besides getting, reoriented to the new standards or to get some new tools, there also is that networking opportunity, particularly within your own type of organization, that gets born from that quality workshop. And I was just we were in San Diego, and in the session that we had, there were a couple people who commented that they don't have, someone asked about the patient's rights with medical home. One of the accredited organizations was there. They've exchanged information, and they're sharing and creating a, little mini collaborative, if you will, to share what they've done, best practices, what works in their organization, and that's really something that I really like to nurture and provide as well. So anyone in Dallas, if you want to reach out to me, whatever you're looking for into that, you're thinking about a chapter, I'll be happy to bridge that gap for you and provide you, with that information. Some of our surveyors are, as I mentioned, from all over, and certainly Texas is one of them. The other thing about attending Achieving Accreditation is it really is a great jumpstart, because it gives you a 2-day opportunity where you immerse yourself in thinking about this whole process and understanding, and also you can bring your own questions that relate to your organization's concerns or dilemmas that you can share and ask either individually or in the conference sessions. We have a lot of interaction with the participants saying, where do you get, best practices for infection control? Do you expect to be CDC compliant, or is it okay to use, some other organization? So we really do recommend it. I just didn't want to highlight it in the sense that, it's something, because there's a cost involved to that. And it is an option for organization. It's not part of the HRSA accreditation initiative.
And we have one more question that is asking, can you review the columns on the self-assessment? In other words, what does reference types mean? And I think that's referring to one of your slides.
Okay, let's see. Here. Let's see. Oh, I think I went too far. Obviously. Did I do that before? Is this what we're talking about here? So if I'm not answering this accurately, please reach out to me, and I will be happy to give you, specific details. One of the things that we did was that we took all the standards and put them in an Excel spreadsheet. And it should be, again, personal to you. So you can do, one column could be the rating, and then if it's a PC, first of all, who's assigned those standards or those chapters, so you can have columns for that. This is for the project manager for accreditation. And then you can have another, this is, something different here too, but you could have a column that gives a date as to when you want due dates or when it's going to be approved by the governing body or what it is that's missing. And it gives you an opportunity to track where you're at any given point in time. Let's see the next standard. These were the chapters, as I mentioned. Again, you can decide who's the most likely person to have it. It doesn't mean that you don't collaborate with others, because it might be the medical director or it might be somebody else for peer review. And again, just going through those standards and getting an idea of where you're at.
Oh, it might be this slide. Nope.
Okay, measure your organization. So this is sort of a summary of what I just showed you on that other slide. Yep. And there are the core chapters and then all the adjunct chapters. When you have it in hand, you get familiar with the book, it'll be a little bit easier to sort of digest, if you will. Let's see what's the next one. Any other questions?
If not, at this time, I'd just like to thank Mona again for providing this presentation through AAAHC. We really appreciate your time and your expertise in helping us to understand some of the resources that are out there in order to receive the PCMH accreditation through a AAAHC. So as I mentioned, her information and contact information will come through on your follow-up email, and I encourage you to take also the survey webinar evaluation that will be coming through as well. So at this time, I think we'll close the webinar. Thank you all for attending. And also, lastly, I forgot to mention that we do have an upcoming webinar on August 22nd that will be on enrollment strategies and successes for enrollment practices. So if you are interested in that registration will be up on our website shortly. With that, I'll say thank you and enjoy the rest of your day.
Thank you, everybody. Appreciate it, and hope this is just the beginning of our conversation.